So let me just share my slides. Hopefully you can see my slides. All right, so again, welcome to the UCL MBA. And just really excited to be here and looking forward to taking you through this presentation. So before I get going, I just want to talk a little more about who we are in case you haven't heard that much about the Global Business School for Health at UCL. So we're a new department school at UCL. We were really organized and founded in the last year. And it's really our, UCL has recognized there's a huge gap in terms of healthcare management leaders. And where have we seen that more as in the last year with the pandemic, as we've really all struggled, to make sure we have the right pathways, supply, chains, and what we need during this difficult time. But in fact, actually, health and healthcare have been rising as not just as a challenge, but also as an opportunity and as a sector across the world over the last decade. Some of that is because of demographic changes, and particularly in places like Europe and parts of Asia, where you've got aging populations, but also in low and middle income countries that have many that have often younger populations, but are seeing an exponential rise in non-communicable diseases such as strokes, diabetes, heart attacks. So really, health and healthcare have become more and more important. Also, we can look and see that there are many countries in the world that have not historically spent much in this area. And so governments are trying now to catch up. And so we're seeing a rise in the percentage of GDP that goes to health and healthcare. We see it going from, in some places, 10%, and in other places like the United States, where it's almost up to 20% of their GDP. So it shouldn't be surprising if I tell you that in the last year, the fastest growing sector of all sectors within the kind of global economy has been the health sector. So we also see, though, that the number of health professionals we have, particularly clinical health professionals, they're just inadequate. We need so many more to really provide the service that's needed. So consequently, then, we've got to think of new business models, and that's where really business and health and healthcare management come into play. We have to reimagine really our whole health ecosystem. We need to think more about how we're going to use digital health and digital technology and innovation. But moreover, we need to think about the kind of larger area that health takes place in. We see that data, analytics, big data and big tech firms are getting more and more into the healthcare space. We need to put our focus much more on preventative healthcare and diagnostics, and less on really thinking about, where, how we're going to treat someone. We want to think about how we can keep people out of hospitals, not about how we can create bigger hospitals. So all of that really takes people with a lot of courage, courageous leaders, people who can be change makers, people who can really reinvent the healthcare landscape. So this is exciting time to get involved. And really, the business and management are at the heart of what was needed in terms of really delivering the different pathways, the different business models, the different dynamics, the new categories of patients, and the ways in which we will take health and healthcare forward. So that's really what the Global Business School of Health is really about. It's about helping you get those skills you need to really make a difference in this sector, both in terms of your own personal development and career, but also in terms of just the school in general. So first of all, I'd like to just take a minute and talk to you about, first, why you would want to do a MBA in health versus a general MBA, because that's a question sometimes I get students answering me. And I always love this quote by the former dean of the Harvard Business School. She said, medicine and business have long been intertwined, but today, with the extraordinary promise of emerging medical technologies, sweeping change in delivery of healthcare, and the push to control the cost of medication, the need for leaders firmly grounded in both fields has never been greater. And that's really what now is needed. We need really people who can think across disciplines, have those cross-disciplinary skills, who can really be those change managers, and who can really offer those kind of essential services. So it doesn't matter if you're a GP, if you're someone who's a business manager, if you're a clinician or non-clinician, really this evolving space and the need for an understanding of the drivers of health as well as business management. I think also one of the things that I always think about is that health systems across the world, we can think about products, we can think about an airline, and we can see all the similarities. When we think about health systems, we see that they're often very contextualized in history, in terms of the values and drivers within a particular society, the way it's shaped over time. So we have almost a different health system for every country that we have in the world. Also, the kind of regulatory space that health and healthcare products and services sit in is highly different than others, because at the end of the day, there's no other sector that's more intertwined with life and death. So having that ability to get all the things, and I will assure you that in the UCL MBA in Health, you get everything you would expect in a general MBA. We've made sure that our MBA is aligned with the Association of MBAs. And so you will get everything that someone in a general MBA would get, but you'll get much more in terms of the health component. This isn't about an MBA that just tacks on a few modules at the end in healthcare. All through, this is a case study approach. You'll get numerous cases and opportunities to interact with health professionals, CEOs, senior managers throughout this program. And I'll talk more about that in just a minute. So the other thing is, why would you do an MBA? And I often get that in terms of, well, gosh, should I do an MSc or should I do an MBA? They're very, very different experiences. An MBA will open you up to numerous career opportunities. It's much more focused on your personal development, building your confidence, you're accelerating your career. So how does an MBA accelerate your career in a different way than, say, an MSc? An MSc gives you really much more subject matter content in an area. An MBA doesn't just give you that, it gives you those really critical strategic leadership skills and abilities. So part of why MBAs really focus on using case studies is, what is a case? Well, a case is a scenario where you'll look at a business. You might look at their finances, you might look at their overall structure, how they're ran, their successes and all various aspects. And then you will have a strategic question that you will try to answer. And you will do this over and over with lots of different kinds of cases in different aspects of running and leading a business. And the idea is to really build up your ability to synthesize lots of information, to then make decisions very quickly. So one of the things that you'll learn across your career is that often people who have had numerous leadership roles and experiences of really leading and managing companies, they learn over time what is the critical information they need, how they can make decisions quickly, when they have to make ambiguous decisions with little information. And that's part of what you learn in an MBA. So it takes, and really what you might have to learn through experience over 10 years, condenses it down into 1 year and brings you out a much more confident and capable leader and manager. So that really will accelerate your career. So the potential for building a portfolio career, pivoting into a new role, the MBA is really a fantastic experience and a very unique experience within your education journey. So I would really equate it to, I often call it almost like a boot camp training in healthcare management, where you really are going to get a focus on, again, all the business management skills, but with this real emphasis in health and healthcare. So you'll get lots of technical skills, financial learning that's integral to anyone who's in a leadership role. And then you'll also get those real, what we often refer to soft skills, but I actually call them critical skills. And that's things around leadership, your understanding your leadership, understanding how to change your leadership style to fit the context in which you're in, and also to lead change. So it's really that credibility that's going to be very important. Now, the other question is, when is the best time to do an MBA? We normally say really early on in your career, and particularly the kind of MBA we're talking about today, this face-to-face MBA is often something people will step out for a year, they'll do the MBA, and then they'll go back into their career. And also mid-career, for people who really want to kind of reboot what they're doing. Now, does that mean that there aren't other times or other peoples or groups of people that can do an MBA? Absolutely, you can. And it's a fantastic opportunity. So regardless when you decide to do your MBA, it's a real worthwhile experience. Now, why UCL and why one in health? Well, there probably couldn't be a better match. UCL is ranked 8th in the world. Much of that is about its research, and much of its research is in the health, medical, and life science space. We're just a powerhouse in this area. And the credibility that a UCL Health MBA will give you is really world-renowned. So it's a great place to do such an MBA. And as I've just articulated, we really understand the health sector and health. It's not an afterthought at UCL. Probably about 70% of what takes place at UCL has some aspect of medicine, life sciences, health, pharmaceuticals, biotechnology. So it really all comes together. And really, one of the things that is exciting about this program is you're not just taught by business management professionals. We really bring those professors in from across UCL. And every single module you'll have is taught by a team, not by an individual. And so, every single aspect of the course is really, you're getting those frontline experts. So that's really exciting. We've also developed a number of additional programs and ways that we will really focus and help you shape your career. One I'm really excited about is the Health Executives in Residence program. So we'll have CEOs, former CEOs, senior leaders in healthcare who will be ready to mentor you and to engage with you. Every semester, you can sign up for office hours. There's 25 of them, and you can have a one-on-one up to 30 minutes each term. So that's a great opportunity to get some time with people who really can help you shape and take your career forward. We'll also be working with a recruitment agency from the very beginning. So I'll talk a little more about the MBA induction. It's quite extensive and an opportunity for you to really, understand and work with others as you move forward. And once you're an alumni, you will be able to tap into our executive education at a substantial reduced rate. You'll always be part of the Global Business School for Health community and family and network. So those connections will really help you across your life. It's like joining a club that really, we're so excited about having you as a part of what we do and go forward. So again, I've mentioned just really when to do your MBA. So what does a typical MBA health student really look like? Well, they tend to be someone, like I said, early or in mid-career. They've had a good academic background, or they've got lots of work experience that they bring to the table. They're ambitious, they're determined, and they're looking to build out into areas either they're in, such as healthcare management or pharma, biotech, consultancy, and they really want to accelerate their career. And last but not least, they want to take advantage of the network of international healthcare peers that they'll get through this program. Some of the career destinations that our students can anticipate, of course, health consultancy, and it's a big area and it's growing. Many organizations, hospitals need help in really making those pivotal decisions, implementing change in this fast-paced world that we live in, where we're seeing so much demand outstrip supply. So there are also opportunities in senior roles in places like pharmaceuticals and biotech, the public-private health space. Of course, if you're in the UK, the NHS, BUPA, the World Health Organization, the list is endless. There's really so much that you can do with a career and an MBA in health. And it is an exciting start and a part of your education, your journey, your work experiences moving forward. I've talked a lot about now just what you can expect, and I've talked a little bit about why we have this MBA Health. I'm going to now move on in just a minute, and talk a little more about the specifics of the program. But before I do that, I just want to say also, what's really important to us is improving patient outcomes, bringing innovation of healthcare settings and championing really universal access to healthcare. So our graduates will be really sought after assets in a world of healthcare delivery. We want really people who are passionate about making a difference, not just for themselves, but for health and healthcare. So I'm going to talk now specifically about the programs. I really think that this program has been structured in a very exciting way. And so one of the things you will have before you even begin the course, once you've been enrolled, you'll be given access to some online courses. They're self-paced and you can take them before you arrive at UCL. And the idea of these courses is really help you just to make sure that everybody coming into the class is on an even playing field. One of the courses I'm most excited about is the Global Health Systems course. That course is being developed by myself and our visiting professor, Mark Brunel, who is a senior executive at KPMG in their global healthcare. Mark's worked in 80 countries, and he's also the author of a book called In Search of the Perfect Health System. So that will be something that we will expect everyone to have worked through that online course ahead of time, so that everybody understands health systems as they come into this program. There'll also be an opportunity to brush up on your finance and accounting and economic skills, your study skills, and your time management skills. Then 2 weeks prior to the start of the academic year, you'll be invited to a real interactive, fun, but very important induction. That induction will include a 3-day residential where we will have asked you prior to joining that event to have completed a number of self-assessments, personality tests. You'll have an opportunity to sit down with a career consultant and a recruiter to really think about who you are, where you're starting, what do you want out of the program, what's your vision. All of this will be an important part of your onboarding. You'll also bond as a cohort. You'll have a number of really prominent influencers in the health space and also the business and management space coming in and running some workshops with you. We see that onboarding process as integral. And last but not least, we'll talk a lot about how to use a case, how to write up a case, how to respond to case studies, since we're going to be using a case study approach throughout the program. So then what does the program look like? Well, the program is designed in blocks. So it's block delivery. You get a number of themes in each of these blocks. So in some ways, a 30-credit module is like taking 3 courses. So before you start, you'll have online materials that you'll read. You'll have the cases, of course, that you'll need to prepare for. And you'll have some videos that you can watch and some discussion forums. Then you'll come for 4 weeks for the first block. The first block is called Strategy, People, and Marketing. How does that work? So you'll get a week. You'll come at about 1 in the afternoon till about 6 in the evening, every single day that week. And you'll have different speakers. You'll be interacting with your colleagues. You'll be presenting these cases. First week is all about strategy. It'll give you really a very firm understanding and basis in strategic leadership and thinking. Second week is around people and human resource management and organizational behavior. Third week is around marketing. And then the fourth week of each of these blocks is what we call wrap-up week. It's an opportunity to pull all those different themes together. And we will have a number of health professionals who will come in, who will facilitate activities, who will talk to you about how they use strategy, human resources, and marketing in their day-to-day activities. And you'll also complete your assessments. Then you'll have 2 weeks to prepare for the next block. The next block is called Funding, Finance, and Regulations. Again, you'll prepare cases, you'll do readings, you'll have interactive activities online. You'll come for 4 weeks of really intense, in-person time. The first week will be on accounting and financial reporting, which of course is so important. The second week is on corporate finance. That'll include things like capital and private equity markets as well. The third week will be on really policies and practices and regulations in healthcare. And then the fourth week, you'll have your wrap up. That will end term 1. You'll finish off any of your assessments. Now in term 2, you'll also have 2 modules, 30 credit modules. The first one's called data-driven management. Again, you'll have a week of economics and health economics, a week of data analytics and visualizing healthcare data. And then the third week is on sustainability in healthcare. And then you'll have your wrap-up week. And then the fourth and final block is actually quite exciting. There'll be a number of electives to choose from. So each theme that you'll have when you come for your face-to-face will depend on which electives that you select. So there'll be things like systems thinking for healthcare, innovation in digital health. There will be population healthcare management, and a number of other topics. So you'll pick 3 of those, and then you'll have your wrap-up week. Now, in your term 3, you'll have 2 projects, but one of the projects you'll have already started because it runs across the whole year. And that project is called the Global Health Challenge. It's a really exciting project. It's an opportunity for you to work in a team, in a group, and really understand what it's like to be an international consultant. So when you're at the very beginning of your academic year, when you're in your induction period, you'll be placed in a group. We'll be placing you to really help you understand how to be not just work on a team project, but how to be a team member on a cross-disciplinary, diverse team. So we'll be looking at your personality tests, helping you understand how do you put together a high-performing team. And they'll be across the year, not just workshops on your project, but workshops on your team dynamics so that you really understand how to be a team player and a team leader. So this project will involve also an in-country component. You'll have 2-week immersion field experience. That'll either be in January, right after the beginning of the year, or it might be in June, depending on the project and the geographic location of that project. You'll work as a team. You'll be working with UCL academics and also people from industry. And really, you will go for that 2-week in-country experience, learn lots more about that particular country's health system, but also the kind of project topic, which will be about solving a health challenge in that country. And then you'll write that up in term 3 with your group members and also have a presentation. So it's just a great project and experience to get in-depth knowledge of what that's like. You'll also have another project that you'll do, and that is the health consultant project. Again, we'll be working with organizations. It's a real world experience. We will be getting briefs from companies, and you can then pick from, it might be a hospital, it could be a private health organization, it could be a public health organization, it could be an international organization, a charity. And you will work either independently or in a small group, depending on the brief and the project. You will act exactly like a consultant. You'll have your brief. You'll be meeting with the organization, either virtually or face-to-face, depending, again, these are global projects. And you will develop your response to the project. You will answer the questions. You will give them the brief. And then the output will be in the form of a paper and a presentation. You will do it for us for your assessment, and then you will also deliver it to the client. So it's a real hands-on consultancy experience, again, to help you really hone in those important skills. So those are the real capstone projects, and I think they're both extremely exciting, and they really will help shape you as a manager and a leader in an organization. So again, as I said, this is really a 12-month, very intense, high energy MBA if done in a year. You can do it over 2 years. We do have a part-time option, and but you would have to have availability to participate in the in-person event. You would just run it over 2 years. You'd have a project each year, and you would do 2 modules each year. So again, anyone interested in the part-time option, I'd be more than happy to walk you through that and talk to you about that. We'll also in 23-24 have an executive MBA that will be mainly online. And for those of you in work who can't take the time to do an in-person MBA, but would like to have the MBA experience, that might be something you want to explore. So this is really for people from lots of different backgrounds. What we're looking for is people who either are in health or want to pivot into health, and who are looking really to accelerate their career as they move forward. In terms of what the requirements are, I'm just going to talk you through those. You do need to have ideally a UK minimum of a 2.1 or above. But work experience, of course, is paramount for an MBA. And so it's really coupling that with your other skills and experiences. Your IELTS will need to be a 6.5 or above, and no area less than a 6. Ideally, we want 2 to 3 years of work experience. If you've worked alongside your degree and had other kinds of work experiences, and you can put those into your CV, we'll consider those as well. We do require a well-balanced a GMAT or a GRE. If there's some reason you believe you should be exempt from that, we ask you to send us your CV and your academic transcript with a statement of why you think we should waive the GMAT for you. And then you'll also, all candidates for the MBA, get an interview after we've gotten your initial application. And also in your application, you'll have, of course, your CV, 2 letters of reference, and a personal statement. And that personal statement is very important in terms of articulating your ambition, not just for the MBA, but what you hope to do afterwards. So it is a very busy kind of admissions process, but the reason is not one of those things. It's really about seeing all of you. So there is no go or no go lines there. It's about really putting together and understanding you as an individual, your motivation, whether or not you have the kind of maturity and are at the right place to really get the most out of this MBA. We want to make sure that your expectations and our expectations align. So I often get questions about the GMAT. It is a test that you can take online. There's also ways that you can prepare for that. I think the best way to prepare for the GMAT is by taking practice exams, and there's lots of free exams that you can try and take. Why do we require the GMAT? Well, because we really want to make sure you've got kind of the abilities. You're going to be simulating lots of information in a very short period of time, preparing for cases. So it really measures your analytical writing skills, your quantitative reasoning skills, and also your verbal skills. So again, it's an important part of your overall. We're not looking for a particular score, but we are looking to understand you better. And then the other area that I get a lot of questions is around the interview. And the interview is after we've assessed your application. It's just like you were applying for a job. Of course, anyone who's applied for a job knows that you often put in, a written application, and then you get an interview. Well, that's kind of how it works with the MBA. You put in your application, we assess it, and then we'll set up an interview for you. The interview questions are very common and very similar to what you would anticipate in a job interview. So I wouldn't get too anxious. It is an online interview. We'll ask you to tell us more about yourself, why you want to do the MBA, what makes you a standout candidate, how you see yourself contributing to the program. And most importantly is, what is your expectations of the program? We want to make sure that your expectations align with ours and that they're realistic. And then, some more just questions about yourself. So it's not a strenuous process, but it is an important part to make sure that us and you are on the same page, and that this is the best MBA program for you. I also want to take a moment and talk about some fantastic scholarships that we have. We have the MBA Health Future Impact Leader Scholarship. We have a number of these scholarships that we're really looking to give away to really exceptional students who apply for the MBA Health. If you're an overseas student, this scholarship can be up to £15,000, and which really brings your fees, your tuition, down to what you pay for a master's program. So it is great. And also for home students, people who work for the NHS, this is a really good value MBA. And again, home students can get up to £15,000 on the fees. Also, we have another scholarship. It can also be taken with the MBA Health Future Impact Leader Scholarship. We've got two other scholarships actually, but one I want to really highlight is Women Healthcare Leader Scholarship. That can again be up to £5,000. It's not just about the discount on your tuition. This scholarship actually gives you the opportunity to really join a coaching kind of mentoring development program that we've established for women healthcare leaders. Now, why have we done that? Because if we look across the healthcare terrain, we see that there are, 80% in some countries like the United States of the workforce in healthcare is made up of women, and yet only 20% of the senior leaders are. And so we really want to help encourage women to A, get an MBA in health, but B, to also get the added confidence and skills they need to really progress their career up into the top table. So it's a wonderful opportunity. And then last but not least, we also have a scholarship for people who live in East London. The reason is because we're located on UCL East, and that is in East London. And so in recognition of that, if you work or live in East London, you can also get $5,000. So all of those scholarships are available. They can be taken in combination. They can be taken individually. I would really encourage anyone who's applying for the MBA to apply for these. I would apply for the scholarship at the same time I submitted my application for the MBA. Our applications are open. We have now started to review applications. We are in the process of setting up interviews. So if you're going to apply, I really encourage you to apply as soon as possible so that we can consider your application. We run rolling admissions at UCL. Again, I also want to mention some other scholarships. There's also loans. There's also private loans. And if you haven't been to one of the talks that we run on scholarships and funding, and you anticipate needing funding, please attend those. Of course, if you're a UK citizen, you've got, you can get loans through the student loan organization. If you're a US citizen, there's federal funded loans that you can apply to, and UCL does qualify for those. There's also a number of scholarships for international students. There's the Chevening, the Commonwealth, the Fulbright, great. And of course, there are other master's bursaries, particularly for UK students. UCL has a great scholarship finder. So if you just Google UCL scholarship finder, you can pull that up. You put in your information and it'll help you identify loans and scholarships. And then just a little more before I finish off and get over to your questions. We have fantastic career support. There are not just, the ones that I mentioned to you, but we will have designated MBA career consultants that will work just with our MBA students. We've also got a fantastic deputy director of our MBA coming in who also has a coaching and mentoring background. So there'll be many opportunities for you to really think about yourself and your personal development to make sure you get the kind of career outcomes you want. And of course, throughout the program, there'll be lots of workshops that you can attend, opportunities to meet. As I've already mentioned, we've got the health executives in residence. So this really is about getting you to the next level. And then, with all of that, I want you to recognize that it's just an incredible experience. It's a lot of fun. It's not transitional, it's transformational. You will also have opportunities to be involved in lots of extracurricular activities. There's fantastic student support at UCL. If you're an international student, we have specific student support for you. But for our home students as well, there's the student support and well-being team. Of course, many of us have mental health and well-being issues, and we need support and we need counseling service. We've got that at UCL, and it can be offered to you in lots of different forms. There are many clubs for you to join, and we're really looking forward to our MBA Health students setting up a club. But there's also volunteering opportunities and other very interesting and worthwhile societies for you to join. And of course, sports. Life in London is just fantastic. There's lots of tourist attractions, sporting events, parks, greeneries, museums, and most of them are free. And so it's not surprising that UK and London is ranked #1 in 2021 in the QS rankings for the best place in the UK to be a student. So really, that's the end of my presentation. I just want to highlight again, I mentioned to you already, but we've got a number of exciting events coming up. We've got the scholarships and funding information session that's on the 22nd. We also have a webinar on health innovation through capital and private equity markets. Really, really interesting speakers for that. So please sign up for that. And then again, if you want to come back, if there's more information that you'd like to learn about the MBA Health, we've got another open day for March and another scholarships and funding session open. So again, I really look forward to engaging with you. I also want to make sure you know that we do offer one-on-one sessions for people applying for the MBA to get application advice and support. If you'd like to have a one-on-one session, just email our admissions team. If you go to our website, you can find that email and where it talks about requesting information, and just say that you'd like a one-on-one session, and we will definitely get that set up for you. So again, I hope you enjoyed the presentation. I'm really looking forward now to your questions. So if you haven't asked a question yet and you're thinking about one, or if you'd like some more information in general, anything that I can help you with and support you with today, I really want to do that now in this last part of this session. So again, thank you so much. And I'll now move and close my presentation and see the questions in the Q&A. So the first one is, are the costs of the field immersion covered in the tuition of the course? So part of it is and part of it's not. So you will have to pay for your flight and your accommodations. We will make sure that those are quite reasonable, and we will be doing a group booking. All your grand transportation, your food, any events that you will attend while you're away, and of course the supervision that you'll receive on that trip are all covered by UCL and through your tuition. Hi, Nora, could you please walk through how the part-time structure would work? Okay, so if you would like to be a part-time student, and most people who, of course, want to be a part-time student are employed and will be in work. So how does it work? So you would be expected in the first year, so it runs over 2 years. In the first year, you'd be expected to attend the induction, and the part of the induction where we have the 3-day residential, you'd need those 3 days off. And then when you go through the blocks, you would be expected to do 1 block in the fall and 1 block in the spring. Those don't start till 1 o'clock. So if you're in work, you could work in the morning and then you'd come and do the block in the afternoon, but your employer would have to give you the afternoon off for over those 4 weeks. And then in the term 2, again, you'd have that. We recommend part-time students don't do the Global Health Challenge in their first year. They do it in their second year, and I'll tell you why. So then in term 3, you do your health consultant project. Again, that wouldn't require you to physically be there, but you'd have to be working on the project part-time. So you would finish then 30 credits in term 1, 30 credits in term 2, and 30 credits in term 3 with that health consultancy project, and have 90 credits. The reason we don't have you do your global health project in the first year is we want you to make sure that you've bonded with the people in your class and in your project. So in the first year, you go to the 3-day residential and you take then those modules that I've just described, and you've really bonded with that cohort of MBA students, because many of them will be full-time. And then in year 2, you will come back. You won't attend induction because you've already been inducted. You'll do again, one of the 30 credit blocks in term 1. So again, you can think about the timing, which ones you want to do, and we can lay out your schedule over the 2 years. You'll need the afternoon off on those weeks, those 4 weeks in the autumn that you'll be attending your MBA. And then in the spring, you'll need the 4 weeks off. And then the afternoons of the 4 weeks off, and you will need depending on if you go in June or if you go in January, depending on what project, you would need those 2 weeks for your overseas experience. And then you would finish that off with your group in term 3. So that's how it would work. As I mentioned, for some people that, you know, if you can work with your employer and get that, that's fantastic. And we have had some people approaches that have been able to negotiate those kind of afternoons off. And then in the second year, those 2 weeks they'll need off. So the other option, of course, is that we will have a mainly online MBA that starts in 23-24. It's called an executive MBA. It's for people who are further on in their career and might find the opportunity cost of taking time off early on in their career more difficult. And that one is, you know, it's face-to-face, but it's mainly virtual. And it has just a 1 week kind of residential in year 1 and a 1 week residential that's overseas in year 2. So we'll have that up on our website later on around April time, and you could take a look at that one if this in-person one would be difficult for you to navigate. This is a great program and a great experience, though, if you can work with your employer to make it happen. Ying Mu, thanks for sharing. Could you please introduce more about students' timetabling during each module, such as lecture hours and hours of events? So again, as I've just explained, if you're looking to do this full time, So you think that a term at UCL runs over 10 weeks, you will have 8 very intense weeks in addition to online work that you'll do. You'll have 4 weeks where you come actually for really about 20 hours a week of class time or each week. So those face-to-face blocks are quite intense. And then you get 2 weeks to prepare for the next one. And again, so you will have lots of face time and interaction. And there'll also, of course, be events in the evenings that you might want to attend. There'll be career events or speakers, but those are really optional. But they, of course, enhance your program. So you'll need to be here for the 2-week induction, and then you would come and you would have your block. So this is very much a face-to-face. Your blocks, though, don't start until the afternoon. You've got your mornings free to prepare or work or whatever you're doing at that time. And then you'll come in the afternoons during those 4-week blocks. I hope that's clear. But if it's not, please ask me more. And again, if you'd like to book a one-on-one and talk about either the experience or your personal details, we can definitely do that. So I've still got some time if there's any other questions that anyone might have. And lastly to say, we often assume that home students are the only ones that work. Many of our international students will work. You can work up to 20 hours a week. And then also international students can apply for a work visa after they finish the program and stay on for 2 more years if they'd like to get more work experience in the UK. All right, I'm just going to wait 1 more minute and see if there's any other questions. If not, you've been a fantastic audience. And again, please book a one-on-one if you want further details, if you want things articulated in a certain way, if you need help with your application. We're really here to support you as you go through this journey of applying for an MBA. And we're really excited to have you consider UCL and the MBA in Health as one of your prospective programs. Okay, so that's it. I don't see any other questions, so I'm going to give you the rest of the afternoon. Thank you so much. Really pleasure meeting you. Take care. Bye.